So addiction, you know, I look at it from a brain perspective, neurophysiologically. Think about what's going on in the brain when somebody's an addict. There's very much a brain phenomenon. If we look at some of the classic images from the Amen Clinic, you know, that looks at the functional MRI images, it's pretty clear that there's a definite pattern in the mind of somebody who has an addiction that is difficult
in the brain.
In the brain. And it's difficult to discern, you know, if you said this person's doing X, you know, you might see some different patterns, you know, heroin addiction to alcohol addiction to gambling addiction, but there are some general patterns that are pretty much the same. And sometimes these patterns are hard to distinguish from obsessive compulsive disorder because it very much operates on the same level cognitively. That being said, what mindfulness is doing is creating different neural pathways. And so what mindfulness is allowing for is for, imagine, you know, somebody's images of the brain while they're in the middle of their addiction, and then using meditation, thought-stopping strategies, grounding strategies, emotional regulation strategies, thought regulation strategies, somatic regulation strategies, and then connecting somebody to their higher self in terms of their values, in terms of their integrity, in terms of their purpose, in terms of what gives them meaning, in terms of you know, how they're utilizing themselves in society more effectively, not being more proactive versus reactive, that sort of thing. And then look at their brain images over time, and you might notice that they have less of a desire for their drugs or their alcohol or whatever. There's a great book that I know you like called Mindful Recovery, which is a fantastic book about using mindfulness and recovery process. So when you take, most addicts, as you know, don't think they have the disease of addiction. You spend most of the time arguing with them, if you want to argue, which I don't. They're arguing with themselves about why they don't have a problem. They come in, you know, saying it's not a problem. It's everybody else's problem, or it might be a problem. And we know about McLennan and other researchers from University of Pennsylvania who talked about the different stages of acceptance of addiction, from pre-contemplation to contemplation, that sort of thing. So people come in with varying forms of denial or minimization or defense mechanisms. Mindfulness allows for people to not have to be in their defenses, to be able to allow the defenses to come down, to feel safe in your office, to feel more calm, to feel more relaxed, to feel more centered, and to be able to observe themselves without the critic being really loud and noisy, or being afraid that you're not going to give them your approval, which sometimes they are concerned about, or that they're going to be judged, that they're going to be, you know, disowned by you or others for being honest about what's going on, feeling safe, and then observing themselves. And sometimes in addiction, mindfulness is helpful for allowing the addict to just observe themselves without judgment. Because sometimes they're so harsh and so judgmental towards themselves that they don't take the time to see what they're doing. It's too painful. It's too hard to see it. So I think mindfulness, because it helps somebody accept that they have the addiction using that strategy. And then in terms of self-efficacy, it can help somebody learn how to self-soothe without going to the drugs and the alcohol for self-soothing, or to feel better without going toward the idolatry of drugs and alcohol for that sense of panacea.
What kind of success have you seen in your practice with addicts in recovery and mindfulness? How's that been working?
You know, a long time ago I developed an instrument called the Drug Avoidance Self-Efficacy Scale, working with addicts.
What is it?
It's called the Drug Avoidance Self-Efficacy Scale, and that's something that what I try to assess in the beginning is self-efficacy, meaning that if I hold the idea that I can be successful taking on a particular challenge, whether it's staying sober or dealing with triggers of drugs and alcohol, if I think I can manage that challenge successfully, I'm more likely to be successful when that challenge comes up for me. So self-efficacy, based on Bandura's work, utilizes that. So what I try to hold is how much self-efficacy does this person have at this moment? Do they feel that they can manage the triggers and challenges when they leave the office? So what I try to do is get a sense of that. So the first thing is to match the treatment plan with where they're at from a self-efficacy standpoint. If they have low self-efficacy, they're more likely to relapse and get triggered when they leave the office.
Wait, so self-efficacy means their ability to negotiate dicey, triggering situations.
Exactly. Yeah. And so I get a sense of that. And if they're really, you know, as you know, that sometimes the hardest thing is to know what level of care do they need. You know, because with addiction, it's so costly. You know, we're talking people die. You know, we're talking serious consequences. You know, not just the loss of relationships and job and self-worth, but we're talking death and disease and, you know, brain damage and other things that are pretty serious, and emotional damage. And very, very severe consequences the longer it goes on. It's progressive, chronic, and fatal addiction, so it's very serious. So we have to look at how to match up the level of intensity of treatment along with the self-efficacy. So if they're not feeling very self-efficacious, then, you know, we have to match the treatment accordingly. And I'm a big believer in the 12-step meetings. And I think that in a lot of ways, people don't necessarily say this, but I believe the 12-step meetings teaches consciousness and teaches mindfulness. And one of the key ways it does that is through the idea of humility. That addicts struggle with humility. We all struggle. I struggle. We all struggle with humility, you know, but addicts in particular struggle with humility. What does it mean to say I have a problem? The hardest thing is just saying that I'm an alcoholic, you know, I'm an addict, and being able to acknowledge that truth. And mindfulness, you know, in a sense, allows us to be compassionate toward who we really are without the judgment. We can acknowledge our suffering without judging ourselves so harshly. We can just hold who we are without the judgment. And that's a key piece. That involves humility, being able to acknowledge that about ourselves in the beginning. And if we can do that, we might set up greater strategies to support ourselves, like the meetings, therapy, you know, using mindfulness strategies, meditation, self-soothing techniques, being around people who are trying to be sober, so we're not just surrounded by people who are using, all those things. You know, mindfully, who am I mindfully around? You know, if I'm not mindful of who I spend time with, I might be triggered. If I'm not mindful of, you know, the drugstore where I buy my booze, then I might use. If I'm not mindful of the times of day that I get high and like to get loaded, I'm more likely to use. If I'm not mindful of, with the diseases of addiction, then I might continue to do it. So I think all these things are very, very important, you know.
Okay, I want to shift over to talking about your work with relationships and relationship issues, and how mindfulness plays out with those, or applies to those, and how you use mindfulness in your, let's say, couples work, or with individuals who are struggling with relationship-related situations. And
well, actually, I'm going to give you some credit. You've influenced me in that way too. One of the things that, you know, that's important for mindfulness is to take a look at, you know, basically, you know, what is yours, what is mine, and what is ours, right?
Wow. That sounds familiar.
Yeah, that's your model, which is brilliant, you know. And so I think sometimes, you know, mindfulness is understanding, you know, where, you know, what isn't mine. You know, sometimes we project things onto each other, you know, as you know. And when we're getting reactive about something, we sometimes like to find, we blame shift. We try to find fault or hold somebody else responsible for how we're feeling inside, or for healing us and making us feel differently. And so, and there's, as you know, a whole history of how we became who we are. And, you know, even though mindfulness is dealing with the here and now, it doesn't mean we ignore the past. For example, Daniel Siegel talks a lot about attachment theory and the intercourse of attachment theory and mindfulness in terms of relating in relationships. And so what we have to take a look at are, what are our attachment styles when we're relating to each other? And for example, we know from, this is pretty common knowledge of, Ainsworth and, Susan Johnson's work and Klein's work and so on and so forth. We're looking at attachment in terms of whether we have a secure attachment base, insecure attachment base. It could be an ambivalent attachment base, anxious attachment base, avoidant attachment style, disorganized attachment style. So a lot of us, through life experiences, develop a certain attachment style orientation in relating to others. And so when I think about people coming in, I look at, how do they get to where they are now? What's been their journey? And then typically in a relationship, we might have the same style or opposing styles. And many therapists have coined this in all kinds of different ways, from the distancer-pursuer dynamic to, the victim-persecutor-rescuer dynamic, to the codependent, counter-dependent dynamic, to, there's all kinds of names we give these things. But a lot of times what we're talking about are attachment challenges. And one of the conundrums with mindfulness is that mindfulness is dealing with the suffering that comes from attachment, which is a different way of understanding it. But the way I look at this, we get attached to holding our partner in a particular way that isn't accurate. That there's an image, we hold our partner in a certain way that isn't real. And that might be a combination of us projecting things onto them. It could be us not realizing they're not static, that they're changing in front of us and we're not seeing their changes. It could be that we're not really listening to them and really hearing what they're trying to tell us on an emotional, cognitive, spiritual, somatic level. So often I think mindfulness is about taking in our partner for who they are right now and being in the moment with them and really, understanding that. So how can we attach to them in the sense of intimacy and closeness, but learn to give up our attachment to these false images of who they are, re-imaging them in a way that's really real. And things like imagotherapy, which is Latin for imaging, is looking at what's the image we hold of a person? Is it real or not real? And then other people like Terence Real take a look at this idea of looking at somebody in terms of their, are we holding an image of them that's essentially cherishable, or are we holding somebody in an image that is not, And Gottman says that couples want to be cherished, that we want to feel affirmed and gotten. And mindfulness is about eliminating the four horsemen from the apocalypse and allowing ourselves to really not hold a core negative image, that's the Terence Real stuff about a person, but to really embrace who they are right now, fully, wholeheartedly. And people like Paul Hatherley, who I really love, talks about this idea of thinking for understanding. When we're listening to somebody, how do we really try to understand what they're telling us and take our own narrative and put it aside and really listen to them? Because most of us listen with our narrative. We have this agenda and we're not really taking in the words, the feelings, the intent of somebody. There's three things that I think are important in working with couples. One is to look at what is the intention, what is the intention that they each have for each other. Do they both want to be married, or do they both want to be together if they're not married? Do they want to work through their problems? Is their intention to be right and make the other one wrong? Is their intention to convince me as a therapist that their position is correct and the other person's is wrong? What is their intention? What do they really want? What's the truest intention they have? And sometimes the intention they say they have versus the intention they really hold is not the same. So sussing out what is the real intention and what intention is going to support the relationship. And what's the heart intention? What's the intention that needs to come from the heart, from an emotional level? And then what is the attention? What are you attending to in the relationship? And I'd say the third part is, what is the attitude, that the person has toward their partner? Is it an attitude of cooperation, collaboration? Or is it an attitude of self-righteousness or self-righteous indignation? So mindfulness can allow us to observe all these different dimensions and to really take a look at how we are showing up, and we want our partners to show up.